All right, let's jump right into a topic that trips up a lot of people: atrial flutter versus atrial fibrillation. Now, you probably know they're both fast heart rhythms that can cause a stroke. But here's the thing: understanding the deep down difference in how they work is absolutely key to managing them correctly. So let's break it all down. So here's our game plan. We're going to start with the basics, then get into the why behind it all, the electrical mechanics. After that, we'll look at how to spot them on an ECG, talk through the treatment playbook, and wrap up with the definitive fix for the most common type of flutter. Okay, so starting from the top, both atrial flutter and AFib are what we call supraventricular tachycardias. Fancy term, but it just means they're fast heart rhythms that start above the ventricles. But honestly, that's kind of where the similarities end. After that, they go in completely different directions.
And it all boils down to this one simple question, really. This is the idea that's going to guide us through this whole thing. Is that fast heartbeat organized and predictable, or is it just total chaos?
That question leads us straight to the core of the issue, the why. Understanding the difference between an organized electrical circuit and just pure electrical chaos is the secret to unlocking everything else, from reading the EKG to picking the right treatment. I think the best way to picture this is with an analogy. Think of atrial flutter like a race car on a track. It's one single, huge, predictable loop going round and round. Now, atrial fibrillation, that's an electrical mosh pit. You've got tons of random signals firing off from all over the place with no rhyme or reason. So let's put the official definition to it. For atrial flutter, the two words you have to remember are organized and macro-reentrant. That one racetrack circuit is what's causing everything, and it's firing away at a super fast but very regular pace. Now compare that to AFib. The key phrase here is disorganized atrial activity. There's no single circuit, no racetrack. It's just electrical anarchy that's hammering the AV node, and that's what gives us that classic irregularly irregular rhythm you see on the monitor. So we have these two totally different electrical events happening. How does that actually look on an ECG? This is where you're going to make the call, so let's decode these patterns. For your classic, typical atrial flutter, the signature look is that sawtooth pattern. You're looking for these very distinct, regular flutter waves. Pro tip, they often show up best as upside-down waves in the inferior leads. That's leads I, 3, and AVF. And AFib? Well, AFib's signature is that it has no signature. It's defined by its lack of a pattern. You won't see any real P waves, just this shaky fibrillatory baseline. And the rhythm of the ventricles is, like we keep saying, irregularly irregular. It's completely unpredictable. Okay, that brings us to the management playbook. Now, even though both of these can lead to a stroke, which is a huge deal, the way we actually manage the rhythm itself is very, very different. But first, let's cover what's exactly the same, because this is super important: stroke prevention. The approach is identical. Doesn't matter if it's flutter or fib, you're going to use the exact same tool to figure out their stroke risk: the CH2DS2 VASC score. The decision to put someone on a blood thinner is based on that score, not on which of these two rhythms they have. But here's the big split in strategy. With atrial flutter, we really prefer a rhythm control strategy. And you might ask, why is that? Well, it's because trying to control the rate in flutter is notoriously tough. That organized, powerful signal from the atria just pounds on the AV node, and you often have to use super high doses of multiple drugs just to try and slow it down. And even then, it often doesn't work that well. And that whole difficulty with rate control leads us perfectly into our last section. Because for the most common kind of atrial flutter, we have an amazingly effective, definitive solution. And this is it. For typical atrial flutter, catheter ablation isn't just one of the options. It's considered the definitive treatment. The whole goal is to go in and permanently break that one single racetrack circuit we've been talking about. Just how effective is it? Well, the success rate is over 95%. I mean, think about that. That is an incredibly high number for any procedure that's meant to be a cure in medicine. It's a total game changer for these patients. So not only is it incredibly successful, but the complication rate is also low. You've got this combination of being super effective and super safe, and that's exactly why going for rhythm control with an ablation is the go-to strategy for typical atrial flutter. So this leaves us with one final thought, a clinical question to chew on. If this procedure is so good and so safe, what are some things about a patient, maybe they've had prior heart surgery or they have other arrhythmias going on, that might make an ablation more complicated? That's the kind of next-level thinking you can bring to the next patient you see with atrial flutter.